This is an example of poor professional boundaries. Mary is a 78-year-old woman with Alzheimer's-related dementia and hypertension who receives services from a home health agency. During a recent home visit, the agency registered nurse supervisor noted that Mary's dementia is progressing to a point where she may soon need full-time skilled nursing care. Mary is very upset at the prospect of leaving her home and refuses to consider a different living arrangement. Yesterday, home health aide David arrived at Mary's home and discovered a burned dish towel in the kitchen sink. When David asked Mary what happened, she said that someone must have left the dish towel on the burner. David also noticed that Mary has forgotten to take her medication again. Mary begs David not to tell anyone about the towel or the meds. David isn't sure what to do. He wants to respect Mary's rights and maintain patient confidentiality, and he doesn't blame her for wanting to stay at home. So what are the issues here? Main issues here, safeguarding. We need to consider personal safety. We need to consider whether Mary is now safe, whether this becomes an issue of self-neglect, which is a clear safeguarding issue. Mary is becoming unpredictable because of her dementia. She is starting to act in a way that is putting herself and potentially others around her at risk, and this needs to be addressed. We have to think of the issue of duty of care versus confidentiality. Now, David is right in his assumption that Mary is entitled to confidentiality, but he also has a duty of care, and in a situation like this, the duty of care will always trump the individual's rights to confidentiality. If he doesn't disclose what he has found out, that means that Mary could go on to do something potentially far worse, which could potentially be fatal to her or to the other people around her. We need to look at the issue of mental capacity. There is nothing in the scenario to suggest that Mary has had her capacity assessed. Under the Mental Capacity Act, the law deems everybody to have capacity unless it has been proven otherwise. So we have to assume that Mary has capacity, which means at the moment she has the right to make her own decisions. And if she is choosing to stay at home, the burden is on the care provider to actually make sure that she can be safe in that home. If they have concerns about their risk assessments, concerns about their ability to keep Mary safe, then they need to be looking at a capacity assessment being done. Once Mary has been assessed as lacking capacity, then certain decisions can be taken on her behalf, as long as those decisions are seen to be in her best interest. As we've already said, the other issue we need to consider is whether Mary has now become potentially a danger to herself and others. We can see that yes, she has left a dish towel to burn on the burner, which potentially could have started a fire. If she lives in a flat, if she lives in a shared living accommodation, she could potentially be endangering other people as well as herself. So we need to look at what can be done to reduce the risks to herself and other people. Whether this be removing the cooker, replacing it with a microwave oven, and teaching her how to use the microwave oven, or whether it be actually getting hot meals brought in for her from an outside agency that eliminates need for her to cook at all. If we cannot do this, then we need to be asking ourselves, is she safe to be cared for at home?